And this, and this. Yeah, do you want to get the purple thing out so we can bring it? She doesn't need no enalapril today. All right, you ready to get her? Emily. Good morning, sweet girl.
Hi, baby.
Emily was diagnosed prenatally at 24 weeks with hypoplastic left heart syndrome. We just kind of dove right in from there and started learning as much as we could and doing what we could at the time.
Biggest concerns, are just, is the baby going to be okay? And, you don't really know what to expect because you hear worst case scenario and
Right.
you hear best case scenario and then you hear complications and things in between. So you're just really trying to figure out what's going to happen, and you can't really do that. So you just kind of take it one day at a time.
So today she's going in for a cath lab procedure, and they don't exactly know if they have to do any interventions yet. They just wanted to get a better pictures and a better idea of what's actually going on. So it's kind of a little tune-up.
Hey. All right, we're here.
Hi, how are you? Once we figured out what the baby's condition was, we kind of started evaluating. Everybody we talked to kind of pointed us towards Glennon. So we made an appointment with Dr. Huddleston, got to talk to him about the situation, and then Barb showed us around.
There's plenty of people to take care of the child, but I'm here to also take care of the families. And I usually try and bring them a level of comfort at a time that's very stressful for them.
She gave us a big hug and she said, you don't want to have to be here, but if you have to be in any pediatric hospital, she's like, this is where you want to be. And I think about that still all the time to this day. You're right, this is exactly where we want to be.
Someone will be with you shortly.
We came and met with the fetal team here and did a lot of fetal echoes on her heart and saw all of that.
We identified some features on her echocardiogram that made us concerned that after delivery she wouldn't have the period of stability like most patients, and so we elected to have her deliver here at Cardinal Glennon.
We were told she had a 50% chance of life when she was born. So obviously we just wanted to see that she was here and that she was doing okay. And then, my mind kind of shifts to, okay, she's here, let's get started.
Day 6 or 7 was surgery day, so she went in for her first open heart surgery.
The first one, although it's not the most complicated, it's probably the highest risk of the 3 operations that she's set to undergo. It's a major alteration to her circulation compared to what it was before the operation. I do it in combination with my partner, Dr. Fiore, and the two of us do these complex cases together because of the nature of what has to be done.
I'd seen other patients with this diagnosis. We would take 2 steps forward, maybe 1 step back with feeding, but there was always the goal to keep going forward. That's Emily, and I think it's a testament to her parents.
I'm the interventional cardiologist.
First thing in the morning when I got there, I went and met with the family, discussed the procedure and what I was planning on doing, and talked to them about the various things that will go on during the case and potential complications.
I don't know if we're going to find anything, so hopefully we don't. Hopefully everything looks great. But if we do, what we could find, we should be able to fix today.
Dr. Petersen had went through a lot of Emily's images with me. On her echocardiogram, she had some blood flow that was going the wrong direction, which we both thought was likely to collateral vessel formation, which isn't uncommon in Glenn patients.
Are you ready? Perfect, thank you so much.
All right, guys, thanks a lot. Bye. We know how the procedure works and what to expect, and so we're fairly confident and comfortable with it by now.
So we'll do Glenn first and then try to get in the innominate vein.
We initially did the procedure. We identified these collateral vessels. When we injected the dye straight down into the neck, it basically did a 180-degree turn, went straight up, did another 180-degree turn, and went straight out.
That angle, I don't think switching to the IJ would help at all. I'm not giving up on this. This is looking promising.
One of the great things about working here is it is a team approach to everything, and I know that even though I'm in the cath lab by myself, there's people I can call and get guidance, assistance, help from if need be. Dr. Webb did come up and she helped me dilate the branch pulmonary arteries. I spoke with Dr. Petersen as well, just making sure everyone stays on the same page.
We need a BMW. We're obviously not getting enough curve with this.
I went through all of the catheters that I could think of, and then the nurse for the case, Beth Price, made a great suggestion of a Berenstein catheter.
If I get this, I'm buying people dinner.
Okay, I can't.
So that's one of them. Beth, thank you so much.
We were able to get into the biggest of the vessels and close that with a device.
Hello?
Lauren?
Yeah.
Hey, it's Beth. I wanted to call and let you know we are all done.
Yay!
Did balloon both of the pulmonary arteries, and we were able to only close one of those collaterals. But Dr. Bob's going to come out, show you pictures, and go over everything, okay?
Okay.
Great. Hey, how's it going? Good. She's doing good.
It was a successful procedure. We were able to close the largest of the collateral vessels as well as dilate the branch pulmonary arteries, which is probably the driving force behind those vessels developing. So we're able to improve the blood flow going to the lungs, and I think in the long term we'll see better saturations leading up to the next stage of her surgery because of it.
It's really exciting. You know, you wait all day, hours and hours, and you just want to get back there as fast as you can. And we're kind of loud and excited, so we kind of forget that people are like just coming out of surgery, but we're always so excited to see her.
Hi, Emily.
One of the best parts has been seeing her, just be happy and
Yeah.
thriving and wanting to live and not having to struggle every day. So
Yeah.
it just makes you feel good, to know that she's happy.
We obviously think she's doing great, but we aren't medical. We don't know all the ins and outs, and so it's good to hear that the medical field thinks she's doing well. We always called her a little feisty fighter, so it definitely, she lives up to her name. You feel so thankful for everybody here because without it, we wouldn't be where we are today with Emily.
The people at Cardinal Glennon have basically allowed us to be happier. Every time Emily smiles and makes us happy, and she's making her grandparents happy and her sister happy and our friends happy, right? Those are a lot of the things that we wouldn't have maybe the opportunity to see and watch her grow up and things like that. So we are very grateful for all the help we've gotten.
Yeah, they've given us our Emily.